Welcome to Perimenopause Hell. This presentation is about itching, otherwise known as formication. The first thing to work out is which phase of perimenopause are you in, because that will tell us what's causing the itching. So the causes of itching in early to mid-peri are usually very different to those in late perimenopause. Just to remind you, late peri is characterized by symptoms such as skipping periods, having hot flashes, night sweats, and experiencing insomnia. So, in late peri, itching is one of many parasthesias, which is a fancy word for weird sensations that are caused by low estrogen. The low estrogen causes your nervous system to misfire. So basically your nerve endings think they're feeling things, but they aren't really feeling anything that's there. So parasthesias include sensations like patches of numbness, burning, tingling feelings, and of course itching. Another one that's not mentioned here is electrical zaps. In fact, there's all sorts of odd, weird sensations that can be known as a parasthesia. There are some causes other than hormones that you should be aware of. Low iron will often cause it. B12 deficiency, calcium deficiency, magnesium deficiency, vitamin E and B5 deficiency. So having those things assessed to see if you're lacking in any of them is often quite useful. However, if you already realised you're in late peri, most likely it is the low estrogen. There are also some illnesses like diabetes that can cause parasthesias. You have in that instance what's called peripheral neuropathy, so it often affects the extremities, like you get tingling hands and that kind of thing. So it's a good idea to speak to your doctor. Formication. Formication is a type of itching that feels like insects crawling on the skin, and the word is derived from formica, which is the Latin word for ants. It feels like ants crawling on you. There are causes of formication that aren't related to hormones, so as we just said, it's a good idea to see your doctor anyway. And many of the medicines that can help this are prescription only, so that's a double good reason to see the doctor. So a quick look at the treatments. You can try and boost your estrogen levels, so you can take phytoestrogen supplements. We have videos about that. I would think if this is one of your main symptoms, but you don't have many other symptoms, then really HRT would be what's known as a hammer to crack a nut. It's it's a strong medicine if itching is your only problem. So there are some medicines that you can use to dampen down the nervous system a bit. A popular one is amitriptyline, which is often known as Elavil in the States. That can help you with sleep, by the way, amitriptyline. So if you take it at, say, 6 in the evening, then you'll get a good night's sleep. Gabapentin, Lyrica and Neurontin, often prescribed for nerve pain, but in a smaller dose to control the sensation. They could be very helpful. They also help with hot flashes too. And duloxetine, otherwise known as Cymbalta, is an antidepressant, but in a lower dose it can help with nerve pain and it can help with these nervous system related symptoms. Just a quick note about genital itching. Often this is once again due to low estrogen levels and vaginal atrophy, but it can also be related to lichen sclerosis and lichen planus, which are skin diseases that can start in perimenopause due to the low estrogen levels. Both of these conditions need treating, and they have videos of their own on our YouTube channel. Just a quick tip here, there are lots of creams that are sold for feminine itching. They usually have lidocaine in them. Sometimes they sting a bit at first, but that wears off quite quickly and they do stop the itching. So they're quite useful until you have a proper treatment regimen in place. So if you're not in late perimenopause, it might just be that you have dry skin, which is very common and very common in late as well. So the obvious solution to this is to use a thick moisturiser. I'm convinced this is where that the old stereotype of the woman in bed with her curlers and the night cream on comes from. I think petroleum jelly, although it's not fashionable to use products that are related to the petrol industry anymore, Vaseline is really helpful because it lasts a long time, and the sort of sticky feeling tends to wear off quite quickly if your skin's really dry. Lidocaine creams that we just mentioned, the feminine itching ones, but there are other ones that are sold just for general itching. They're really very helpful. And evening primrose oil by mouth, not used as a moisturizer in any sort of way, taken in the capsule form, at least 2,000 milligrams daily, is very, very helpful and just make you have beautiful soft skin anyhow. Allergies are something you have to watch out for in perimenopause because developing new allergies is very common, and it may actually result in hives or dermatitis. So the best thing you can do is really avoid whatever you've become allergic to. You can get assessments that show what you're allergic to, so that's a very good idea. Antihistamine tablets will help, and there are antihistamine creams too. If you are in a very bad way due to allergies, you can get steroid tablets from the doctor, but obviously you'll need an appointment to get some of those. There are various skin problems that also start during perimenopause. These are because they're usually autoimmune, and the lower estrogen can have this triggering effect on the immune system. So some forms of dermatitis, including perioral dermatitis, I beg your pardon, and that usually is like red patches around your mouth and under your nose. And it isn't the usual treatment for that. You might need antibiotics for it. It's a very unusual type of skin disease. Rosacea is another one, which means your face gets kind of red. I'd see a dermatologist about most of these problems, by the way. Prickly heat is another really common one, which looks like a lot of little tiny blisters. And usually that's from increased sweating because of all the hot flashes and stuff. And fungal infections also, again, from the sweating. We have a video about a problem called intertrigo that you should watch if you suspect you have that. Under the breasts is a really common place for that. Armpits and groin as well. Eczema and psoriasis can, of course, you may not ever have had them in your life before, and they can suddenly appear. So it's a very good idea to go and see a dermatologist, because also it's worth mentioning that GPs quite often don't really know what a particular skin problem is, and they're just going to prescribe you a cream and hope that it works. You can, of course, diagnose for yourself in much the same way as a GP would, by trying various things and seeing how they work. So you can usually get a low-dose hydrocortisone from a chemist, and you can get antibiotic creams, especially if you're in the States. These are quite common, so you can try those. And antifungal creams like Monostat, they're also quite helpful. So what you can do is use one of these for a couple of days on your skin problem and just see if it works, right? It's not a very sophisticated form of diagnosis, this, but if you use one of those three, you should eventually hit upon something that does the job. Anyhow, that's the end of this video. If you liked it and you found it useful, then subscribe and recommend it to your friends and all that. The link to our Facebook group is in the description box below. We also have a MeWe. So really, that's the end of everything. Thank you for watching.